Hello, and welcome again to our series. This is Title V in New Mexico. In this video, we will discuss a few of the Title V supported initiatives for infant health in the state. Two of the Title V initiatives that we will talk about in this video include breastfeeding and safe sleep. New Mexico Women, Infants, and Children, or WIC's Special Supplemental Nutrition Program, is involved in several initiatives to improve breastfeeding outcomes in New Mexico. WIC collaborates with Title V to improve breastfeeding rates, support families with breastfeeding duration, and to improve health provider lactation support. For example, WIC trains their staff on USDA breastfeeding education and promotion. WIC also participates in the 4-day lactation training program that is available to WIC nutritionists. And they have expanded the use of their Hug Your Baby trainings that teach WIC personnel normal baby behavior related to feeding and sleeping. WIC staff use these trainings and resources to educate families and support happy and healthy breastfeeding relationships. WIC also has a breastfeeding peer counselor program that provides one-on-one breastfeeding counseling support to women at delivery and when they return home or to work with their baby. Support is provided either through phone calls or home and hospital visits to WIC participants. At some locations, peer-to-peer counseling hospital visits may be available for non-WIC participants. The Breastfeeding Peer Counselor Program is in 65 WIC sites and 11 hospitals where lactation resources are most needed. In an effort to expand support and resources to all communities in New Mexico, there are also a number of statewide breastfeeding initiatives and partnerships. In 2018, New Mexico's Breastfeeding Task Force collaborated with tribal health promotion organizations and the Navajo Breastfeeding Coalition to expand support in their hospitals. By sharing staff knowledge, this led to improvements across the state for local breastfeeding coalitions. The Breastfeeding on the Border project is an effort to increase breastfeeding rates in U.S.-Mexico border communities. Each state coordinates its own project and partners and supports each other's efforts by sharing resources, trainings, workshops, and funding when possible. The goals of the New Mexico project include increasing breastfeeding rates in 3 border communities in New Mexico. Specifically, the goals adopt objectives from Healthy People 2020, the federal preventative health program, such as to build on the Baby-Friendly Hospital Initiative that provides resources for lactation support after hospital discharge. Baby-Friendly USA is a hospital designation that involves a 10-step process to ensure that mothers have information and confidence to successfully start and continue breastfeeding. At these hospitals, breastfeeding is supported as a part of the bonding process between mother and baby. Title V programs and the New Mexico Breastfeeding Task Force monitor the experiences of women through the PRAM survey and provide feedback to hospitals on the delivery of their baby-friendly practices. In New Mexico, there are 30 hospital facilities with maternity units, and 8 are designated as baby-friendly. 4 of these hospitals are a part of the Indian Health Services. Safe sleep is another important health topic for infants. Title V supports safe sleep initiatives and collaborates with several partners to promote safe sleep environments and prevent sleep-related deaths for New Mexico's infants. One Title V supported initiative is safe sleep training for Child Protective Services staff, home visitors, and perinatal case managers. These trainings are delivered both through in-person train-the-trainer sessions and online through web-based lessons. Through these 2 methods, approximately 1,200 Child Protective Services staff members have been trained on safe sleep since 2017. Safe sleep guidance is provided by the American Academy of Pediatrics and is championed by the New Mexico Pediatric Society. Some of the safe sleep tips included in these trainings are: always place baby on his or her back to sleep. Use a separate sleep area in the same room as a parent, such as a crib or bassinet. And keep the sleep area clear of blankets or stuffed toys. Breastfeeding and avoiding prenatal and postpartum tobacco exposure are also important protective factors. Another way Title V is supporting safe sleep efforts is through the development of a Safe Sleep Strategic Plan. This is a statewide initiative to standardize the information shared with providers and families about safe sleep, to help ensure that all New Mexicans have the same access to the most up-to-date information and resources. The strategic plan will include input from a diverse group, including doctors, parents, community health workers, and case managers. Lastly, let's talk about the Title V-supported New Mexico Birth Equity Collaborative. The New Mexico Birth Equity Collaborative is a diverse team of stakeholders and community leaders. The group collaborates to address the high infant mortality and prematurity rates among African Americans and is focused on creating greater health equity for mothers. The current initiatives of the New Mexico Birth Equity Collaborative are working to center the voices and expertise of African American women. They're going to increase the public knowledge of birthing options and risk and protective factors, provide stress reduction services for childbearing persons along with provider and public health workforce training and education, and engage community members most impacted by these health inequities in story collection to increase public awareness and inform MCH workforce training content. Well, thanks for tuning in to learn more about the ways that Title V is supporting the health of New Mexico's infants. To learn more about New Mexico's other Title V initiatives, be sure to check out the other videos in the series. Want to learn more? Check out these websites for information about New Mexico's infant health programs.